UVA's Cardiothoracic Surgery program is a place where innovation, training, and patient outcomes intersect. With a rising need for transplant and urgency of ECMO rescue, UVA's protocol-driven approach reliably bridges patients safely to transplant. At UVA, saving lives is a team culture.
The history of collaboration at UVA goes back decades at this point. We've been always using a team approach between cardiology, cardiac surgery, anesthesia. It's in the walls of UVA.
What makes the integrated cardiothoracic surgery program here unique at the University of Virginia is really the clinical culture and experience has evolved around the training perspective of our trainees in terms of making our trainees at the forefront of operating in the operating room, making sure that they're learning to become very safe and proficient surgeons with appropriate supervision, as well as a real nod toward education in terms of training future surgeons down the line, leading from the fellow down in terms of what exposure our residents get.
For our bridge to transplant for lung transplant patients, we really have an early multidisciplinary approach. As soon as a patient who's potentially a lung transplant candidate is admitted to the hospital, we do a thorough evaluation for what their ECMO candidacy and cannulation strategy might be. And then we really monitor them very closely. And as soon as we show signs that they're having trouble doing the prehabilitation, maintaining their strength and nutrition, that's one of our triggers to move towards ECMO sooner rather than later so that they have the best outcomes going in and coming out of transplant.
Transplant cases, the multidisciplinary coordination is done with a close collaboration between the medicine and surgical leads for that week, and then we do have a nurse practitioner team that kind of coordinates with the fellows and other parts of the thoracic surgery service. We'll recruit the cardiac surgeons as needed for the ECMO cannulation. Our transplant program has really protocolized in some ways the progression of the patients through these various pathways of are they getting sicker, do they need ECMO, are they able to rehabilitate before the transplant. And so our team has come together to protocolize when we pull the trigger on those various therapies and how patients are able to get these life-saving therapies safely. And so I think that's been a big part of our success.
My pulmonary health journey began at the very end of 2021 when I was diagnosed with nonspecific interstitial lung disease. Fast forward to 2025, I had a fungal infection in my chest and lungs that required a resection. Due to my compromised pulmonary health, I wasn't able to make a full recovery. I returned to UVA at the emergency room with worsening shortness of breath. I wasn't really able to make a full recovery. And from there, my condition continued to deteriorate, ultimately culminating with me being placed on a respirator for about 3 weeks, most of which I was unconscious for. After about 3 weeks, I was placed on ECMO for about 3 days, while the pulmonary team made the decision to have me listed for a double lung transplant. 16 hours after being listed for transplant, my new lungs were found and I was being prepped for surgery. I recovered in the ICU for about 3 weeks before going to a inpatient pulmonary rehabilitation center. And from there, I continued to see my team and returned home and feeling very healthy and very good.
The importance of accurate and timely cannulation in rescue scenarios is to ensure that you have a patient who's salvageable and to prevent end organ dysfunction that may negatively impair the recovery process. What stands out about Saint Hereford's case, of course, is his age. To see a patient so young require lung transplantation is sometimes daunting. However, what is very similar to a lot of cases that we do with our lung transplant team is a great collaborative effort to ensure early intervention, and that allows a patient to go through the operative process and the perioperative process with minimal complications in restoration of proper organ function.
The moment I returned home and saw my kids and ran around with them with no shortness of breath, I knew my lung transplant had changed my life.
I think UVA's cardiothoracic surgery program is something that I'm very proud of. We offer the full range, comprehensive services of cardiothoracic surgery, and really place a strong emphasis both on excellent patient outcomes, but also on training the next generation of surgeons. I think that's something that we all value very highly, and we're able to pass along our knowledge while taking care of patients, and that allows for the next generation of surgeons to grow and to flourish.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.